My name is Dr. Andrew Reisner, and I'm speaking to give a short overview of the work we're doing at Massachusetts General Hospital, which is funded by the state of Massachusetts Spinal Cord Injury Cure Research Program. Our research concerns a new computer system to ensure that patients get perfect management of their blood pressure after acute spinal cord injury. Blood pressure is often very low when you have an injury to the nerves that regulate blood pressure. With low blood pressure, you get low blood flow, and with low blood flow, you get reduced healing of injured spinal cord. And in studies, patients with better blood pressure maintenance after injury were 11 times more likely to regain spinal cord function. So although blood pressure management is very important, the fact is that clinicians often fail to manage blood pressure properly. The clinical challenge is that blood pressure needs to be kept high enough, but it's actually not good if it's too high. And this is done by different medications or fluids. And underlying this is the fact that blood pressure is not constant. It's a moving target. It's going up and down through time. So to try and get a patient right to the correct goal blood pressure, it's a little like navigating a boat. When there's currents and winds pushing you this way and that, and you're trying to stay on course. So it can be challenging. And the fact remains that today's blood pressure management is often simply not good, according to many different studies, because of these challenges of getting it as optimal as possible. So our solution is an artificial intelligence-based software guidance system. And the principle, it's a lot like these statistical systems that can analyze weather patterns and predict what's going to happen the next day or the day after. Well, likewise, we've used similar statistical technology to come up with a forecasting method that can predict what's going to happen to a patient's blood pressure in the near future. And based on that, the system can make advisories about when it's time for a clinician to make an intervention. We have been working on this for 6 to 7 years, and beyond the core artificial intelligence components, we've also built all the other pieces necessary for a real medical device. And this includes methods of detecting errors when the system is not working as it should be, a control panel that's easy for doctors and nurses to use, training to teach clinicians how to use the system, and even cybersecurity so that the software is safe to be deployed into hospitals. This leads us to our program that's funded by the Massachusetts Department of Public Health. With this funding, now in our third year, we have completed a phase 1 clinical trial. A phase 1 clinical trial is where you investigate the technical function of a medical device, and it's regulated by the United States FDA. The regulation is to make sure that a new device is safe for use in patients in the investigation, and that's very appropriate, but it also means that it's a resource-intensive process to comply with all of those regulations. So this is something that through the funding from the Spinal Cord Injury Cure Research Program, we've been able to accomplish, and we've completed the trial successfully. In addition, in doing this testing, we've realized that there were a few opportunities to further refine the software device, and we've done so when we've completed that just this year. I'm really happy to say that our clinical testing results have been excellent. We have met or exceeded our technical goals for the system. Specifically, the predictive capability in real ICU patients at Mass General, again, met or exceeded the goals that we set. And we also have a separate data set of archive data from acute spinal cord injury patients, and we were able to simulate real-time use of those patients. And again, we met or exceeded our performance goals. This means that we're on track for a system, and the remaining step would be one more trial where the technology is used to really manage blood pressure and definitively show that you get better care with this technology. And that's something that we think is a realistic goal to have completed within 3 to 4 years. And so this could be actually a therapeutic tool that's widely available. On this slide, the items in bold are the accomplishments from this year. And I'd like to conclude by saying that my teammates and I are just truly honored to have had an opportunity to advance medical care for people with acute spinal cord injury. We realize that this is only through the support of this program, and as well individuals from the Greater Boston chapter of the United Spinal Association. And I'd like to thank Ryan DeRoche for all of his help with our presentation, and Dr. Eric Ruby for all of his support of our research program, and finally, Deborah Thomas from the Massachusetts DPH for her support. So on behalf of our entire research team, thank you very much, and we look forward to the final chapter of getting our technology out where we can make a real-world impact. Thank you so much.